So I think everybody knows the big thing we are facing right now is sadly the Omicron variant, which is coming very quick and very fast. And I think one of the advantages we have here in Canada and in Ontario is we're not the first place to be dealing with the Omicron variant. We can see a little bit of what has happened elsewhere and learn from that. That being said, we've only known about this variant for just over 3 weeks. We know only very little about it, so the head start we have is only small. So I think we need to make sure we do the best with that little head start we have. South Africa is, of course, the country that first identified the Omicron variant. We don't know if it originated there. It may have originated elsewhere, and South Africa was the first country with the sophistication to identify it. If you take a look at how their case curve has evolved over the course of the pandemic, they've, of course, had 3 waves. And you can see most recently how sharply the case line has been rising here. And this is all due to the Omicron variant. I also want to emphasize, if you look at the other waves, there's kind of a slow build up and it slowly accelerates going upwards. There's kind of a gradual build up until it goes up sharply. With the Omicron variant, you see actually a very quick acceleration to when it is rising very sharply there. Now that's South Africa. Parts of Europe have been affected with the Omicron variant as well. This is Norway, similar there. You'll note they actually have been seeing cases rising for probably about a month before the Omicron variant arrived. But you can kind of get a sense here that there's a bit of a, I guess, inflection point where the cases have started to rise more sharply. And of course, you can see their cases now are far higher than they've been at any point previously in the pandemic. Denmark has also identified the Omicron variant, and this is what they are seeing. Again, like Norway, they were seeing cases rise for a while. Those are both Scandinavian countries with lots of links. But you can kind of see an inflection point here where the speed at which it was rising started to go up very rapidly. And so, now they are far higher than they've ever been before in terms of the cases. And that's one of the big, I think, elements to understand about the Omicron variant. It spreads very quickly and it starts to rise very fast once it has a chance to establish itself. Now, I just want to draw in here the Ontario case curve because I think it does show us something that's important to note in that we are starting down here, whereas other countries were starting way up here when the Omicron variant hit. So I think all the hard work that we have been doing over the past many months to keep cases under control relatively so here in Ontario and in Niagara has meant that we actually have a little bit of time for our cases to go up, and we have that extra space to be able to react and hopefully be able to control it better than some of these other countries have done. And I think that does put us into a little bit of a better place than some of these other places have been. Just want to switch here though to point out what the Omicron variant is already doing here closer to home. And this is the Kingston, Frontenac, Lennox, and Addington area of Ontario. They're the first area in Ontario that identified the Omicron variant about 3 weeks ago, actually. It turns out that they identified it closer to 2 weeks ago, but realized it had been there about 3 weeks ago. And this is what their case curve has looked like through the pandemic. And you can see actually much smaller waves in the second and third wave compared to what they are dealing with now. Now, again, they were seeing cases go up for a little bit heading into the point the Omicron variant arrived. But you can kind of see here that once the Omicron variant arrived, start of December, those cases started to shoot up in a way that was much steeper than what they had been seeing before. And again, I think that is just the nature of this virus and how quickly it's going to spread. Here in Niagara, I think the story is a little bit better than, of course, Kingston. We have managed to keep our cases relatively lower, far lower than we were in the second and third wave of late. But you can see we've had the increase in cases of late, which has mirrored much of Ontario. And you can get a sense there's an inflection point here where the cases start to go up much more steeply. And I think that is a reflection that this week we started to, first positively identify the Omicron variant, and we are now seeing it starting to rise rapidly as a consequence of that. The Ontario case curve, looking at it a bit more closely, again, you can see there is a very steep rise now they are seeing. And that's because province-wide, the majority of infections now are actually due to the Omicron variant. And so that, sharp line is probably going to continue increasing. And I just want to emphasize how steep that line is, that if I draw a line here, that's sort of the slope of what the third wave looked like when it was increasing, and I draw that same slope here, you can see that the blue line is deviated from that and is now rising more sharply than that slope was previously. And so cases are going to rise more quickly now with the Omicron variant than I think we have seen at any point previous in this pandemic. If you've been paying attention to the Ontario case counts, you may have noted that we were in the mid-1,000, 1,600, 1,800 earlier in the week. Yesterday, the province had 2,400 cases. Today, they had 3,100 cases, giving you a sense of how quickly that's rising. The curve I show you here is a 7-day average. And the reason I do that is that actually smooths out the line so it looks a little bit nicer. I'm just going to show you what it looks like without that smoothing, because this number here isn't a reflection of today so much as it's an average of today plus the previous 6 days to get that 7-day average. So looking at it as just the cases per day, I think gives you a better sense of what is actually happening. As you can see, it's a very messy line now, which is why I tend to do that average that smooths it out. But you can see here how sharply and uniformly it now seems to be rising over the last few days. And it's, of course, more than halfway to the level of our third wave peak. So it is coming here very fast now. This is some work done by the Ontario Science Table where they've split out what is happening with the Omicron variant versus what's happening with the Delta variant, which is basically all of our other cases. And you can see that that Omicron variant pattern is that sharp, almost vertical upwards trajectory in cases. We've had a, more gentle upwards trajectory of our Delta variant cases. But if you look here, that this is now at 80 cases per million per day. 80 cases per million per day is actually lower, is higher than what we're seeing with the Delta variant. And so that shows you the Omicron variant is now over 50% of the cases in Ontario. And of course, it's rising rapidly. And this pattern here is, increasingly going to dominate over whatever pattern we're seeing from this. I also want to emphasize that, of course, the Omicron variant, we only learned about this 3 weeks ago. It's only been in Ontario for about 3 weeks. But in that 3-week period, we've seen this very sharp increase in it, and to the point that it has overtaken Delta variant in how many cases we are. And I think that just emphasizes how quick and fast this variant is going to come. This is just showing, 100% of the cases in Ontario and what's the breakdown. So this orange region here is a Delta variant. And this blue region here is the Omicron variant, and you can see it's basically displacing the Delta variant going forward. And that's similar to what we saw earlier in the year, where back here, the orange represented the original version of COVID-19 we got, and the blue is the Alpha variant, and that's slowly replaced the original version of COVID-19. And then the orange, which is Delta variant here now, started to replace the Alpha variant. We're now seeing that replacement of the Delta variant with the Omicron variant. But unlike here, where if you look, starting in January, took until, end of April, about 3 months. And then from April, you're going until almost August before it's replaced it completely, 3 months. We're going to see that replacement probably happen in a matter of weeks rather than months as this spreads so quickly. I've talked in the past about the effective reproduction number. And what this number means is that for every case of COVID-19, how many people does that person infect? So one case leads to how many cases in the next generation. And so if that number is above 1, each person is spreading to more than just one person, that means your cases are going to continue to grow over time. If it's less than 1, each person is spreading to fewer than one person, that means your cases will die out over time. If you're at 1, it's going to be flat. And you can see going back to December, we had, it was above 1 going into our second wave, above 1 going into our third wave, which makes sense, above 1 going into the kind of small wave we had in August and September, and more recently with cases going up, it's been above 1. But you can see we've, 2 is up here, 1 is here. We've probably been between 1.1 and, up to 1.3, maybe going up to 1.5, 1.6 very briefly here. That's kind of the range in which our effective reproductive number is played. If we take a look at what's happening with the Delta variant and we just split that out, going back to this, we'll see that with the Delta variant, yeah, we're at 1.1, 1.2 in terms of the increase. With the Delta variant, that effective reproduction number is actually 4.5. it is far higher than anything we've seen previously, which again emphasizes how much we're going to see cases go up much more quickly than we have seen previously. And I just want to kind of highlight how this exponential growth ends up working. So if we take, Delta variant, reproductive number of 1.3, over the course of a few days, we would see kind of a growth like this. It's actually, you can barely even make out that is, has grown to a little bit more there. And that's because every generation, it's increasing by about 30%. Here, every generation is increasing by 350%. And so over the course of a few days, you're going to see cases kind of go up at a much more sharp angle like that. And so when the Ontario Science Table modeled out what they're going to see, this is what they came up with. Gray is the trajectory we are currently on. And then the pink here is the range of what they estimate is going to happen. And as you can see, you have this pretty sharp increase that we're going to see. We're December 17th, and I told you that we had 3,100 cases today. So we're probably, somewhere around there, which means that we're kind of in the middle of that range. And so if we are expecting that to continue on, you can see by the time you get to Christmas time, the middle of that range is going to be up at, 6,000 to 7,000 cases. So that's really just a week away from now. This dotted line here is about 4,900 cases, which is the previous high that we have ever seen in Ontario. And so, sometime next week, we are going to set a new record in terms of our number of cases, given how quickly this is unfortunately rising. And I just want to emphasize, comparing the Omicron variant to other variants, we started off with a basic reproductive number. So not the effective reproductive number, which is a representation of what is the spread given everything we're doing to control the virus. Basic reproductive number is if you're doing absolutely nothing and it's just spreading through society, what would happen? And it started off that you had a reproductive number of 2.4. A European variant, which is actually what arrived here and was what we were dealing with all of 2020, reproductive number a little bit higher at 3. That's what we developed our vaccine to fight. And of course, we got a vaccine that was quite effective. And at that time, there's a chance that we could actually get to herd immunity. We just needed 70% of our population fully vaccinated. And we're actually at 76%. So if we're actually dealing with that old variant, the pandemic could be over by now because we are actually well above that herd immunity threshold. But of course, we got the Alpha variant, higher reproductive number, spreads more easily. Vaccine, maybe a touch less effective, meant to herd immunity became more difficult. Delta variant, again, spreads even more easily. The vaccine's a little bit less effective. We now got to herd immunity, which is starting to reach to a point that's not going to be realistically possible. When we get to the Omicron variant, we don't actually just have a kind of incremental increase that we've seen here. The basic reproductive number of this is probably on the order of like 20. It's massively higher than anything we've dealt with before. And unfortunately, the vaccine efficacy for 2 doses seems to go down quite a lot. Now, I'll talk more about this, that actually the vaccine efficacy to prevent hospitalization, severe illness, actually is a lot higher than this. It's only about preventing base infection, where it's dropped quite a bit. But regardless, with that, we're not even theoretically able to get the herd immunity anymore. And so this is going to be very difficult for us to control, and I think it's effectively impossible for us to control this virus going forward. Just want to highlight here this graphic showing the reproductive number of the various variants in some other viruses. Measles was previously our most contagious virus at about 18, and we probably now have a virus that has overtaken measles as the most infectious virus we know, with the Omicron variant. Now, given this, as I'm saying, it's going to be near impossible to control the spread of cases. This virus, I think, is going to move too fast. But ultimately, I think we don't actually need to control cases at the end of the day. We've had a strategy that if we keep cases down, that means the fraction of people who can have severe illness amongst the cases is a very small number. That means we have very few people being hospitalized and unfortunately passing away from COVID-19. I think our strategy is going to have to change, that we can't control cases anymore. So we need to prevent the severe illness. We're going to have a lot larger cases, but we try to shrink that fraction of those cases that are actually going to be severely ill, that are going to need to be hospitalized, and are going to unfortunately pass away. And of course, one big benefit we have is that we already have 76% of our population fully vaccinated, so they're getting that benefit, so that right off the bat, there's a lot fewer people who are going to be vulnerable to that severe illness. This is, of course, again, the graph that I was just showing you a moment ago about how quickly cases are going to rise if the Omicron variant compared to the Delta variant. If we're looking then at hospitalizations, it's going to pretty much mirror that. This would be our Delta variant hospitalizations and how they would increase. And the Omicron variant, assuming it was as severe as the Delta variant, would rise something like this. I think there's been a lot of thought and hope that maybe the Omicron variant might turn out to be less severe, and there's some thought it maybe is only about 75% as severe. And if it's a little less severe, does that mean that that balances out the fact that it's rising so quickly? And unfortunately, it doesn't, given that we're dealing with exponential growth of virus. And so if I draw in what the hospitalizations would look like with the Omicron variant, if we're only dealing with something 75% as severe, it looks something like this. We actually start off with lower hospitalizations for a short period of time, but then because so many cases are building up here, the fraction of cases, even though that fraction is smaller, it's on a much larger number of cases, and so we ultimately do end up with more hospitalizations. And that's going to be part of the challenge we have to deal with, that we can't just bank on the hope that maybe this turns out to be less severe, because even if it's less severe, the cases are going to build up so much, we'll still end up with more people with severe illness. And I'll just show you how this looks, of course, the course of a bit of a longer period of time. Eventually this starts to become a really far higher number of cases than we would have seen with, or hospitalizations we would have seen with the Delta variant. Now, let's just kind of as a thought experience say that if this is, turns out to not just be a little bit less severe, let's say it's extremely less severe. Let's say we go down to a virus that's only about 10% as severe as the Delta variant. What good does that do for us? And so again, this is what we would see with hospitalizations with the Delta variant, increasing, not too drastically. This is how hospitalizations would increase with the Omicron variant. We would get a period of time where the hospitalizations are lower, but eventually it'll eclipse what the Delta variant would have caused, and it'll start to go much higher. And again, that's just because even though only 10% of 10% of the previous group who might be hospitalized are going to get that hospitalization and that severe illness, the cases are going to grow so quickly that even that small fraction of people being hospitalized is eventually going to add up to a very large number. And that is, I think, still going to be the big challenge we have to do, to find a way to lessen the increase of this hospitalization curve by doing the things that are going to lessen the likelihood of severe illness. Just want to quickly show you what South Africa is seeing here. So dark line here is hospitalizations. The orange line here is ICU. The yellow and the kind of pale pink line here are, people receiving ventilation and oxygen. You can see all of these have been going up since the end of November, really in line with the Omicron variant, really showing that the Omicron variant is absolutely going to lead to increases in hospitalizations and people who are needing ICU care. And you can see, sadly, the deaths have been increasing in Gauteng, South Africa, where the Omicron variant first appeared. Important to note that Gauteng has a population where the average age is 27, ours is 41. We know COVID-19 is more severe in older people, so we are at greater risk of seeing more hospitalizations and more people passing away. Other part here is that in South Africa, they have not managed to control COVID-19 nearly as well as we have. And it's estimated that 90% of their population has already been infected, whereas maybe 10% of our population has been infected. And so even with high degree of immunity from having had infection already, they are seeing those cases go up, as I showed you previously, and they're seeing the hospitalizations and the deaths go up. And so having prior immunity is unfortunately not going to necessarily, save people from this infection. That's not really as much of an issue for us here in Ontario, given that we don't have a lot of that natural immunity. We fortunately do have a lot more vaccine-derived immunity than South Africa. And one thing we do know is the vaccine has generally given us better protection than getting the infection naturally. Just want to show you this other set of graphs here from the science table in South Africa. So this purple line here was the original wave of COVID-19 in South Africa. The Dark line here was the second wave. The yellow line was a third wave. And as I described earlier, in previous waves, you had a kind of gentle increase and a gentle acceleration of cases. And you can see here how that acceleration with the Omicron variant is very, very sharp and very, very fast. It starts to rise quickly much earlier. And that actually translates over into hospitalizations, not as rising as fast as the cases, fortunately, but it does rise very quickly and faster than we've seen hospitalizations rise with previous variants. Fortunately, even though they've seen that increase in deaths, the deaths aren't yet increasing at the same rate as we've seen in other waves. And that gives us some little hope that maybe actually having that immunity already in society, while it might not prevent hospitalizations, it is going to do a much better job at preventing people from having that most severe of outcomes, which is, of course, passing away. This is the data out of Denmark showing orange line for cases going up and the dark line for hospital occupancy also going up. And they're showing that the fraction of people who are hospitalized with the Omicron variant isn't lower than the fraction of people hospitalized for the Delta variant and other variants. And so we probably cannot, again, rely on this variant being less severe to hopefully save us. We are going to need to act to hopefully stop it from causing that severe illness. So this is what the science table is projecting will happen with ICU admissions. It's not going to rise quite as quickly as the cases because people become infected and it takes a while for them to get more severe and end up in ICUs. But as you can see, as we get past the holiday period, there's a potential we could start to see much higher increases. And if we're kind of in the middle of that pink range, we're talking 300-400 people being in an ICU. Even if it's less severe, we eventually do see that increase. Maybe we're only at 350 or so people in the ICU by the end of the month. We take a look at what hospitalization and ICU numbers have looked like in the province. So the orange line here are ICU numbers. Where again, because we've done a pretty good job of controlling COVID-19 over the last several months, we're starting off at a relatively low point. We're a little over 100. We'll be rising up, as I said, to 300-400 based on the modeling that I just showed you. So that will start to put us, maybe halfway up to where we were in the third wave. And so that does give us some sense that there's a little bit more time that we are going to have to be able to try and get control and slow down those hospitalizations increasing, because our hospitals have shown that they can get up to, the high hundreds before. But definitely we are going to need to make sure we find a way to lessen those severe illnesses before we get to a point in we're exceeding the ability of our hospitals to manage. So I already alluded to one of the things that we are going to be able to do to hopefully control this, and that is, of course, vaccination. I mentioned the vaccine is only about 33% effective when fully vaccinated now, preventing illness from COVID-19. The good news is that if we do a booster dose, though, that 33% goes up to close to about 75% based on the data coming out of South Africa. I think there's a reason to hope that it's actually going to be better here. We've seen consistently that the vaccine has actually given us better efficacy when you space the doses out, which is what we did here in Canada. So I actually think we're probably going to start off with a higher number than 33% here in Ontario. We don't have enough data yet to know what it is in Ontario, but I'm hopeful we'll actually start off with a higher number. And as we get booster doses, especially to the most vulnerable people, we'll actually get them higher than 75% protection, hopefully to a very high level of protection again. And so particularly the people who are most vulnerable, we'll be able to prevent them from getting infection outright, which will mean we don't have to worry about them having this severe illness. And they're, of course, the group who's most likely to get severe illness, our elderly and vulnerable people. In terms of severe illness, the data out of South Africa is showing that people still have 70% protection from severe illness with 2 doses. So those of us who are fully vaccinated are still going to really benefit from not getting severe illness thanks to that vaccine. We don't quite know what the impact of the booster is, but if the booster had this much benefit, our hope is that we're probably going to see upwards of 90% protection. And so again, the people who are older, who are more at risk of severe outcomes, really important we make sure they get their booster dose, because hopefully that is going to make sure we blunt a lot of the severe impact we're going to be seeing. Now, this is data coming out of South Africa. And South Africa, like most countries, had people who were vaccinated with Pfizer only about 3 weeks apart. And we've seen with our data in Canada and even some data in the UK, where you spaced out that first and second dose, you actually end up with better protection. And so our data right now in Canada is showing that we're probably close to 40 to 50% protection from 2 doses. So that's certainly very good. And that hopefully means that a booster dose will get us even higher than just 75% protection. And it hopefully also means that from severe illness, we are going to be higher than just 70% protection from severe illness. And our 2 doses of vaccine are going to help. This is the data the science table has put out and what we are seeing in terms of how much protection people who are fully vaccinated have. And you can see people who are fully vaccinated were about 90% protected from COVID-19 overall. That maybe fell to 85%. With the Omicron variant, it's probably fallen maybe closer to about 50% protection now. And that probably is a little bit lower because we still have a bit of Delta variant averaging a number higher, but 40 to 50% protection seems to be what we're getting with this virus. So far, you can see we're not actually seeing any real decline in hospitalizations or ICU in the protection from that severe illness. It's probably early days and we need to watch this for maybe another week or two to see the impact of what the Omicron variant is having. But this is suggestive that we'll hopefully end up with a little better protection than other countries have with our 2 doses of vaccine. And we'll hopefully end up with still some pretty good protection against being hospitalized or ending up in ICUs. So those booster doses, I think, are going to be really important for us going forward to protect the people most vulnerable, those in most risk of severe illness, so we can minimize the severe illness from this Omicron wave. That being said, if we look at the science tables data, they say while even 2 doses will provide strong protection against severe illness and booster doses will substantially increase that protection, increasing vaccination is not going to be enough. And they've called for what they're calling circuit breaker measures with strong additional measures to reduce people's close contact to 50% of what it is. And I think that's why we saw the announcement by the province on Friday that they're going to bring in some gathering limits and capacity limits to start to make that impact. And the science table, I think, was hoping that with those measures, we could hopefully move off this pink trajectory and onto something like the green trajectory, where we wouldn't see quite that increase in cases. Now, we didn't see those measures come in place on December 15th. They came in on December 19th, so it's going to be later. I also don't think that gathering limits and reducing capacity to 50% is going to reduce everybody's contacts by 50%. That's going to reduce contacts in those settings, but in workplaces, in social settings, particularly social settings which are not large crowds, that's not going to necessarily change people's close contacts. And I think the key thing we're going to have to take away from this is that we can't rely on these capacity limits are going to be what's going to bring our cases down. We've seen in past waves, the province, would bring in capacity limits and we'd still continue to see cases go up. And with the Omicron variant, it's going to spread even more quickly. I think it's going to be even less effective. I think there's going to be a need for a lot of personal behavior change for us to be able to keep those cases under control. And if we take a look at what the science table talked about, they highlight the circuit breakers, they talk about accelerated booster doses, but they also reinforce the importance of key behaviors that each of us needs to practice. We all need to wear a well-fitting mask, we need to keep distance, we need to avoid poorly ventilated spaces, and we're going to need to also be very strategic about use of rapid tests, and all of that is going to be important for us personally to do our part to reduce the spread of infection. If we're not doing these things, especially over the holiday season when we're going to normally have a lot more social interaction, I think that is going to give the virus a lot of help spreading. We can already see the virus is spreading really fast on its own. It doesn't need any of our help. And we really need to be doing things that we can in our personal lives to reduce that spread. And that's, of course, a really hard message for everybody going into the holiday season. But I think the only way we're going to be able to keep cases under control is if we take some of these other measures going forward. Just to highlight, I think the way we're going to be dealing with this wave is going to be very different than how we dealt with past waves of the infection. So thus far, I think, our whole strategy has been to keep cases low. If we keep cases low, the fraction of people who can be hospitalized is going to be of a low number. We're going to have few people getting severely ill. We've basically recommended anybody who has symptoms of illness, they should get tested. We're going to make sure we find every case. We're going to isolate the case. We're going to trace their contacts. We're going to isolate them. We're going to break off chains of transmission. We're going to make sure places that are in outbreaks, whether they're long-term care homes or workplaces or social settings, we're going to help them support outbreaks to bring that spread of infection down. And then we're going to occasionally put in some targeted measures, looking at the patterns of spread in our region, and then use targeted measures to address that pattern of spread in the highest risk settings. That, I think, has worked for us for 21 months. I don't think it's going to work anymore for a few reasons. First off is we are not going to be able to keep cases low. Cases are going to explode to a point that I think we have not seen before. And I think our strategy is going to have to be less about keeping cases low, which we're not going to be able to do, but at least keep the hospitalization numbers manageable and not overwhelm our hospital sector. So, getting booster doses to those people who are most vulnerable, protecting the settings where we have vulnerable elderly people, making sure that we have medications to treat COVID-19 available for the people who do get hospitalized. That's all going to help us hopefully limit the amount of time people are in hospital and then keep them out of the hospital. And that's going to have to be much more focused going forward than keeping the cases low, which I think is no longer possible. We need to, voluntarily, I think, on ourselves, start to, if we do get symptoms of illness, isolate, stay home. I don't think there's going to be enough testing very soon in the Niagara or really in the province to be able to test everybody, because we're going to see a complete explosion of our numbers of cases. And tests are going to have to start to be prioritized to where it informs medical decision making. Anybody who has symptoms of illness just needs to isolate, stay home, and that's going to be it going forward for the next little while. Obviously, if we're not able to test everyone, we're not going to be able to find all of our cases and follow up with them or our contacts. And so people are going to voluntarily have to just stay home and let their own contacts know going forward. We're not going to be able to support every outbreak because there's probably going to be too many outbreaks. And so we're only going to be able to manage the outbreaks in congregate settings, places where people are living, where there's no choice but to manage that outbreak to hopefully protect the people there. In places like a school, a workplace, a community setting, I think those settings are just going to have to close and wait out for the outbreak to be over and then reopen once that outbreak is over. And we're not going to be able to do targeted measures in areas of high risk, because without being able to follow up with all our cases and not having the capacity to do that, we aren't going to know what the patterns of spread in our community are. And so we're going to be increasingly see big, broad measures to prevent spread, because we're not going to be able to do those targeted measures again. And so I think we're going to see a very different wave than we've seen in previously, and a different way of approaching or managing this pandemic over the next 2 to 3 months. Of course, some of this work, if we're no longer following up with cases, we're not necessarily following up with every contact, may give us some room that we can free up some staff to go do additional booster doses, which will of course be really important for managing this stage of the pandemic. Last thing I just want to quickly talk about is vaccinations. And I just want to start out by highlighting what we are seeing in terms of spread by age group in our community. You can see 60, 70-year-olds and older. They are actually the group that unfortunately seeing cases rise, but they are still lower than other groups in terms of cases rising. And it's still younger age groups, particularly, where we are seeing the highest rise in cases. We do a bigger breakdown into some of those younger age groups. I think it's notable that the red line here, which is the 6 to 11 age group, remains the group with the highest risk of infection spreading. And I think it's really important that we make sure that children continue to get that first dose of infection, given that they are such a big risk. In the province, it's even more stark. If you look at the 5 to 11 age group, which is this orange line here, you can see provincially they remain by far the group with the most infection spreading amongst them. And so really want to make sure that, only a few days more until the holidays, it's really important everybody who has a child in that age group, make sure to get them an appointment and hopefully get them vaccinated before that happens. In terms of our vaccine uptake so far amongst children, we're actually making some good progress in the 12 to 17-year age group. We've got 76% of them fully vaccinated. We've got another 4%, got their first dose, so hopefully they'll get their second dose soon, and we'll hopefully be pushing on 80% of them fully vaccinated. Our 5 to 11 age group, which I was hoping we would see, a much higher uptake, maybe 50, 60% vaccinated by the holidays. Unfortunately, we've only got 35% of them to get that first dose. We've got a few more booked in for appointments, but unfortunately, almost 2/3 of them currently are not moving forward with vaccination. And I hope we'll see some change in that, because as I've highlighted, they are the age group who has the highest risk of getting sick from COVID-19 right now. Of course, we have lots of people we need to be vaccinating right now. We've got lots and lots of people who are eligible now for booster doses, with the 18 to 49 age group becoming eligible today. We still, of course, want to do those first doses for people who don't have them, including the children 5 to 11. We need to do second doses for people. So overall, there's a lot of vaccination that we're going to hopefully be doing over the next few months, especially the booster doses, and particularly, I think, for our oldest residents to make sure that they are protected going into the early days of the pandemic, where it's going to be particularly dangerous for them. If we take a look at how our vaccine uptake is going, and apologies, this is up to end of December 19th, not 16th. You can see our first doses, those are our second doses, and then I've drawn in third doses here in green. And you can see we're getting those booster doses out to our most elderly residents. So we're making sure we're going to get them protected, hopefully, before we see the worst of this wave. We're also getting booster doses out to some of our younger age groups, particularly, I think, the 60-year-olds, who are, of course, another really high priority there, to make sure they have protection going forward. And hopefully we'll be able to see some big increases amongst these groups over the next few days, so we can make sure they're really well protected going forward. We're doing everything we can to ramp up vaccinations. We can see since August, where we were doing maybe at most 2,000 doses a day, dropping down to even 1,000 doses a day in October, November. You can see we're starting to get much higher numbers of doses. It's dropped a little over the weekend, but even that weekend was higher than we've been in past months. And I imagine today we'll be back up in the 4,000 to 5,000 range in terms of doses we're delivering. And so all partners in Niagara, I think, are doing what they can to make sure we get as many booster doses out as quickly as possible. Lots of things have changed since the spring, though, which does make it difficult for us to necessarily get as many booster doses out as quickly as possible. And I know there's a lot of people who want to get their booster dose right away, which is really good. But I think we need to remember that it's not just something we can do in a few days. Unfortunately, we do no longer have access to all of the big sites we're doing vaccination on earlier in the year. You've probably seen that we've just secured the Scotiabank Center in Niagara Falls and now have clinics booked in for that, as well as we have a large space in the Penn Center, so we're starting to be able to do larger volumes of vaccination. Staffing is going to be a challenge. There's been a lot of healthcare worker attrition over the last several months, as many healthcare workers have become really burnt out from the pandemic, left the field. Many are, even going off on medical leave, just given the level of burnout. And I think as we see the spread of the Omicron variant, we're going to have healthcare workers who get sick, and they're not going to be available to work in the system. And making sure we have enough people in the hospitals to deal with a spike they're going to see there, while still being able to do all of the other work, such as vaccination and the public health work, that is going to be a real challenge going forward to make sure we can keep vaccinating as quickly as we can. Back in the spring, we benefited from low case numbers. So staff weren't getting sick and being in isolation. They were able to work in our clinics. We weren't doing many contact tracing because there weren't many cases to contact trace. We didn't have many outbreaks, so we didn't have to have a lot of people working on outbreak management. That's all, of course, tying up staff now, which makes it more difficult to do vaccinations. Schools were closed in the spring as well, which meant we didn't have a lot of staff working to try and support schools to stay open. This is hopefully something that's going to change in this coming week as schools go on to their winter break, which will allow us to move more staff into doing some vaccinations for a little bit at least. In summertime, hospitals always see a drop-off in people who come. The wintertime seems to be a time when there are more illnesses, given flu and cold viruses are going around. It's slippery outside. People maybe are getting to more injuries. We're, of course, going into the time when hospitals are already stretched, and so that's going to make it difficult for hospitals to free up staff to do vaccination. Summer, we benefited that health professional students were on their summer break, so they were able to help out in our clinics. We're trying to see what we can do to actually get them to help out over the next little while again, but of course, they're in school, so it's a little bit more challenging to secure that. And back in the spring, we were in a lockdown, so people were staying home. They weren't out and about. They weren't actually ending up with those injuries that are, stressing the hospitals. If they did get sick with COVID-19, they hadn't really been around many people, so there wasn't as much work to do with contact tracing. We have things very open right now in society, and that means for every case, there's lots and lots of contacts. There's a lot of people out and about who are getting sick, and that's going to, of course, increase the workload for all of us. We're doing as much as we can though to address these. As I mentioned, we've secured some more sites. We're trying to free up as much staff as we can, but that's going to mean backing off on following up with cases, following up with contacts, working to keep schools open, doing managing outbreaks. All of that is going to be one of the casualties as we try to get our vaccine delivery up. And again, just to highlight that even if we get up to 6,000-7,000 doses a day, which is where I think we can very reasonably get to, we're still looking at 35, 40 plus days to vaccinate even just the people who need their boosters. Not getting into the children who might be signing up for first or second doses, or adults who decide to sign up for a first and second dose. We are looking at many weeks long process to deliver the level of vaccines we need to, which is why I think it'd be really good if the province would prioritize that we vaccinate the people at highest risk first before moving to a lower risk group, rather than having no priorities, which means we're not necessarily always going to be delivering vaccines to the group who's at greatest risk of severe illness. And I think that is, a mistake that's being made in the province right now. Obviously, headlines across the province, we've seen some of the complaints here locally as well, where the number of people who want to get their booster doses, and rightly so, they're I think making the right choice, seeking out that booster dose, is really stretching every region's ability to deliver those booster doses. You can see the huge lineup they had here in London, Ontario, where people are lining up for booster doses. Unfortunately, vaccinating in a few days everybody, that 318,000 for booster doses I talked about, is just not going to be realistic. This is going to be many weeks, and I think we all need to understand that. And I think, again, if the province is going to prioritize booster doses, I hope that people like me who are a little bit younger will hopefully hold off getting the booster dose and give that opportunity to people who are older, who are at greater risk of being severely ill. So we make sure we blunt the severe illness from this wave. We limit the hospitalizations. We particularly limit the suffering and death that's going to occur. Going forward, then, I think the key thing here is we've got some modest measures by the province to start to limit spread of infection. We're doing booster doses as quickly as we can, but those measures the province has put in place aren't going to be enough to stop the spread of COVID-19. It's going to slow it a little bit. It's not going to stop it. It's not nearly strong enough. I hope the province will think about maybe some additional measures. I think an easy one would be the big, crowds in sports stadiums and the like. I think we could stop those. That would, have minimal social harm and would do a real impact in stopping the spread of infections, and continue to think, what else can we roll back? We're going to keep doing as much as we can to speed up booster doses, but that's going to be a many weeks process. And because these circuit breakers and these booster doses are not going to be enough to slow the spread of infection, I think there's going to be a huge onus on all of us as individuals to do our part to make sure we're not helping the virus, which is doing well enough on its own, and we're doing what we can to combat the virus. And that means wearing masks, keeping distance, keeping our social gatherings small over the holidays, making sure we stay out of places that are poorly ventilated. All of those things I think are going to be really important for us to be able to limit the spread of infection and really limit the severe impacts of this wave. If we're going to have big gatherings over the holidays and not worry about the spread of COVID-19, that virus is going to be able to spread uncontrollably, and we're going to see a much bigger impact on our society. And I hope everybody, as difficult as it is going into the holiday season, buys into the importance of us doing all of these things to keep ourselves safe. And so I'll stop there and turn it over to Alex to moderate the questions.
All right, thanks, Dr. Hergy. So I'm just going to move down the list. So first up, we have CHCH. So you should be able to unmute now.
Hi there, Matt Ingram from CHCH. I was wondering, Dr. Hergy, if you could tell me, given the importance of booster shots that you've been talking about during this presentation, what the demand has been like so far in Niagara for the 50 and up, and if you have any insights on what the demand has been like today for the 18 and up category.
It's hard to quantify the demand. It's extremely strong. There's lots and lots of people who want to get out and get their booster dose, which I think is great news. I think people will definitely benefit from that booster dose, especially in those older age groups. How many people, it's hard to say. As soon as, as fast as we put up vaccination appointments, those appointments are of course taken up, and there's still many more people who want to get an appointment. So all I can say is it's very strong. We're trying as hard as we can to get appointments for people to meet it, but it's going to be a challenge to get everybody vaccinated quickly, and we're going to do as much as we can to speed that up.
You have a follow-up, Matt?
Thanks very much. Yes, I was wondering if you, just about the schools, you had mentioned just a little while ago that with the schools going into holiday break, you're going to have more staff available to work on managing the pandemic. I'm wondering then if that's the situation, if you think it makes sense for kids to be back in classes in January, or is online learning a safer option for managing the pandemic for the entire region?
You know, I think if you're looking purely at just safety from COVID-19, of course, it's going to be safer to have kids only doing online learning. That being said, I think there's huge social benefit from kids being in school. I think kids really suffer when they aren't in school, and I think we need to balance that out. You know, are schools essential? I think arguably they definitely are, and this is perhaps one of the places where we shouldn't be, you know, closing off. I particularly feel that if we're going to keep a lot of places out in the community, like bars open and dance clubs open, and they can still operate at 50% capacity. And we can have tens of thousands of people going to sporting events. It does not make any sense to be closing schools. All of those places have much less social value, and they should be closed so that we can keep schools open instead.
Thank you.
All right, up next we have Ludwig, so you should be able to unmute now.
Thank you so much. Hello, everyone. Hello, Dr. Hergy. Thanks for taking my question. I'm wondering, just given the rise of the Omicron variant and that we're pretty much looking at an inevitable scenario with a whole lot of cases popping up, what are the what's the outlook for powerful measures that we saw during the waves that so far were the highest ones, you know, the first, second, third, in terms of closing down businesses and really just cutting off meeting points for the public? Like, what do you think is the outlook on that, given the rapid spread?
You know, that's probably a question better directed to the provincial government, because they're the ones who put those lockdown measures in place. The sense I'm getting is I'm not optimistic they're going to do a lot more. They really were very slow, I think, to even bring in the capacity limits that they finally announced on Friday. And of course, those are pretty modest ones. You know, I would hope at the very least they will address things like the big sporting events and those big crowds, so we can at least address some of those that at least have, you know, relatively low social value, that are particularly high risk, and where I feel, you know, big pro sports teams, they're going to do okay if they go into a lockdown. They're not going to be run out of business. I do think we need to, though, think about having stronger measures, because the more we slow the spread with those measures, the slower cases will rise, the more time we'll have to vaccinate people and give them protection from booster doses. And I think we should be looking at least at some additional measures on that front.
And a follow-up?
Yes, thank you. And I also noticed that we're having a vaccine clinic pop up here in Thorold this week. I think it's the first one we've seen here. I know there's no appointment necessary. So what is it going to be still on a first come, first served basis for boosters and things like that?
I'm not familiar with the Thorold Clinic. This would not be a pop-up that's being organized by Public Health, so I can't really speak more about it.
All right, next up we have Paul. You should be able to unmute now.
Can you hear me?
Yep.
Oh, thanks, Alex. So, Dr. Hergy, we've all heard these initial media reports about Omicron possibly being less severe symptom-wise, and you delved into data that, you know, showing that the caseload could be so large that it could actually be much worse. But do you have are you concerned that the public might be lulled into a false sense of security in terms of the seriousness of the symptoms it can cause?
I think, unfortunately, there's definitely some people in the public who are being falsely reassured by very weak evidence that this virus is going to be less severe. I don't think we still know. Is it going to be less severe? Is it going to be no less severe? I think the jury's still out on that. There's some weak evidence suggesting it might be. And I think some people have really grasped onto that in hopes, you know, that this isn't going to be as bad as we think. But I think that is really just people clinging to hope. I don't think it's really something that's very objective. And as you say, it may well turn out that it is less severe, but that's not going to really stop us from seeing an absolute surge of people getting severely ill still, just given the number of cases and the number of people getting sick is going to be so high.
Follow up, Paul?
Yes, and given the headlines that Omicron is gaining, do you hope that this could be a motivating factor to get holdouts vaccinated, or do you think that they're so entrenched that nothing will get them to
I do hope that we're going to start to see more people sign up for that first and that second dose. While I've emphasized booster doses are going to give you the best protection, even a first dose is going to be better than not having a dose. 2 doses is better than having only 1 dose. Booster dose is going to be better than 2 doses. And it's interesting, we are seeing in our clinics that people across all age groups, again, are signing up for first doses and second doses. And so I do think the fear of the Omicron variant has motivated some of those who've held out until now to really start to rethink and start to make the good decision to start to get vaccinated. I just worry that, we are going to, within a couple of weeks, really be into astronomically high case numbers. So it's a bit late, unfortunately, to start getting vaccinated. You're not, the first part of the pandemic will have already hit us before they have any immunity. But regardless, the wave is going to last, 2 or 3 months. So if you start getting vaccinated now, it's going to definitely give you protection for at least part of that wave.
All right, next up we have Penny.
Hi, thank you. Dr. Hirji, I know you've spoken extensively about the challenge of getting more vaccination appointments opened up and what you're trying to do to increase the number of appointments to meet a very high demand. You're aware, I'm sure, of the frustration of people trying to, hearing how important it is, but not being able to get appointments for that 3rd dose. The Scotiabank obviously came along at the right time. Are there other possibilities that you're working on? You spoke of the Penn Center as well as a fairly large space. Are there possibilities that we haven't heard about yet, or are you limited to what you're working with now?
We're not really looking at any other possibilities. We think between the Scotiabank Center, the Penn Center, and some of the other sites that we have, we're going to be able to deliver the maximum number of vaccines that is realistic. So we're not looking at any additional sites at this point.
And a follow-up?
Yes, you mentioned that obviously a contributing factor to the number of appointments you can offer is the shortage of staff. I have heard of volunteers offering to help out. We heard that early on in the pandemic, although we haven't heard it so much recently. Is Niagara Public Health hearing from people who are interested in volunteering and helping out at clinics doing some of the jobs that aren't, the public health people aren't needed for?
Yeah, no, we've absolutely heard from lots of people who've reached out to offer their support, which is, really heartening, and we're definitely taking their names down, and we'll be hopefully be able to get their help in our clinic. So, continue to encourage if people do want to contact us. I think the email address is phvolunteers@niagararegion.ca, and they can send an email there and let us know that they're interested, and we'll definitely have work for them to do.
Thank you.
Next up, we have Zara.
Hi there, Doctor. Obviously, last week Health Canada announced the travel advisory for Canadians to consider not traveling outside of the country unless for essential purposes. So I'm wondering what the Niagara Region Public Health advisory is on traveling to internationally during this time, and in particular, the United States.
Yeah, well, really, I'd say for the past 6 to 8 weeks, our advice to the public has been to forego any non-essential travel, especially travel to the United States, where cases have been far higher there than they have been on our side of the border. And I think people, when they travel, are going to take on a lot of risk. So I'm very pleased to see that the federal government has now agreed with us that people should not be making those trips. I think, even going for simple things like shopping or the like, you're definitely putting yourself at risk. And we've seen, even just over the last few weeks, we've seen a big increase in the number of people who are coming back across the US border who are infected with COVID-19. We are previously seeing, on the average of maybe a person a day, and that's going up to 3, 4, even higher than that on some days now.
Follow up?
Yeah, I guess more of a sort of a soft, more of a sort of philosophical question, if you will. But with the holidays coming up and many people, sort of anxious to visit families in the US, and like you said, people sort of now just getting used to the idea of being able to pop over to Buffalo for a day trip. What are your plans to sort of communicate with the public on, the region's advisories for traveling to the US?
Yeah, we've, I think, been sharing that message for several weeks, and we'll continue to share that message to discourage people to do any kind of travel. I think the bigger priority is going to be the more general message around we need to limit our social contacts. We need to keep our holiday gatherings small, because even if you stay on this side of the border and you have a whole bunch of people over, that's going to increase your risk of infection spreading. COVID cases are high in the community. They're going to be much higher, I think, by the weekend, and there's going to be a lot of risk from that. And so whether you're traveling, whether you're staying home, I think there's going to be a lot of risk from infection. And we need to keep our gatherings small, minimize the number of people we have social contacts with, and really, I think, dig deep to just deal with the difficult situation we're in for this. I don't think it's the way anybody wanted to celebrate these holidays, but unfortunately, I think it's ending up what we're going to need to do to keep our community safe.
Thank you.
Gord, I see observer in your name, so just confirming you don't have any questions.
So yeah, I do.
Oh,
yeah,
okay,
I don't know
go
why
ahead.
that's there.
Okay.
Okay, Dr. Hurd, you just wondered, do you have a number for how many eligible people in Niagara have not got vaccinated yet? Approximately.
Yeah, actually, I put that slide up earlier, which kind of showed that number. So the number of people needing a first dose was, I'd say, 65 to 70,000 on that range, noting that about 28,000 of the 22,000 of them are children 5 to 11 who've just gotten the opportunity to get vaccinated.
And what is supply also an issue, or is it strictly demand versus capacity as far as the long times to get booked appointments?
It's strictly an issue of demand versus capacity here. We have no shortage of supply of vaccines for at least the next little while. Obviously, we don't have 300,000 some doses sitting in the vault, but our expectation is that the vaccine supply chain will be there if we need it. Right now, the issue is making sure we just are able to offer the appointments for the huge demand there is.
All right, so it looks that we have about 10 minutes left, so I will open it up for second questions. If anybody does have one, you can just let me know. Okay, we will turn it over to CHCH. You should be able to unmute now.
Thanks very much. Thanks for the extra question. I appreciate it. Dr. Hirji, just building on what you said with appointments being snapped up the moment they're put on in terms of demand, I'm just wondering, just so I have a better idea how it works, how frequently does public health find out about new appointments available that they can, advertise to people who are looking for it? And what would your message be to people who are frustrated? We're hearing a lot of message of frustration in media. Perhaps you could share some of the messages of frustration that I'm sure public health is getting.
Yeah, we're definitely hearing those messages of frustration as well. Really every couple of days we are releasing new appointments into the system as we find ways to secure additional staff and increase the appointments out there. We're also paying very close attention to appointments for that 5 to 11 age group. We've definitely seen appointments slow down there. And so every couple of days, we're making a decision to turn over some of those appointments into being adult appointments so more people can sign up for boosters. So my advice for people is, keep checking back on the provincial portal periodically, a couple times a day. There's, new appointments will be periodically become available. So hopefully you'll be able to get one of those. If you follow us for our social media channels, we definitely advertise there whenever we have new appointments going up. And the other thing to remember is that there's people who are actually canceling their appointments too. There's people who end up finding an appointment through a pharmacist and they get their appointment there. So their appointment on the provincial system ends up being released, or they realize that they're not able to go to their appointment and so they reschedule. And so those appointments also start to pop up a little bit. And so if you keep checking back on the provincial portal, hopefully you'll find it. And of course, make sure to contact the other options you have for vaccination. Check your primary care provider, see if they are doing vaccinations. If so, that could be your way in. If you, are able to get an appointment through a pharmacy, that's another way to get your appointment. Don't just, focus only on the provincial portal.
Thank you very much.